News 10 NBC, covering Rochester and all of Western New York. Coverage you can count on. This is News 10 NBC at 5.
A local surgeon is making a world of difference for babies born with a potentially life-threatening form of scoliosis or curvature of the spine. Medical reporter Robin DeWitt shows us a new procedure that's already changed the life of a little girl.
It's nice. She's finally starting to jump and she's running.
In fact, 2-year-old Paige Smith can't sit still. It's a joy for her to be able to move. Paige has an aggressive form of infantile scoliosis. It can lead to a short, painful, crippling life.
Back in February, she was to the point where she needed surgery, so we decided to try the casting.
Paige's back has a severe curve. A spinal fusion was not an option for U of R Medical Center spine surgeon Dr. Paul Rubry.
I knew that she had a substantial curvature and was in for real trouble in her future with the curve that she had.
Teens with scoliosis can wear a brace to limit the curvature with good results. But for infants and toddlers, braces just don't work. Spine surgery at a young age limits growth, but organs still grow, and kids like Paige end up living on respirators or dying young because their lungs grow too big for their bodies. But this unique treatment could be the answer for children like Paige. First pioneered in England by this woman, Professor Min Mehta, she is now training doctors in the U.S. to use a series of casts that gently and permanently guide the spine back into its correct position.
It's a lot like when someone has braces on their teeth and they would go to the orthodontist and get an adjustment and they will gradually straighten the teeth. We can do the same thing with interval bracing.
Her first cast was done in Erie, Pennsylvania, but Dr. Rubry wanted to learn the procedure so she could continue to get help here at home.
That's all right.
Erie, Chicago, and Salt Lake City, and now the U of R Medical Center in Rochester are the only places in the U.S. performing the unique casting procedure.
Yeah.
A total of 6 families as far away as New Mexico traveled to Rochester this week for the procedure. Children will have their cast change every 2 to 4 months for the next 2 years. A last chance for parents who just want their kids to grow up.
Just being able to keep up with other kids her age would be nice, and just to live a normal life, just to be happy and healthy.
Robin DeWitt, News 10 NBC.
This new casting procedure started in England with a mother whose child had progressive infantile scoliosis. Now she's trying to raise awareness and help centers like the U of R with training programs.